can I describe my treatment philosophy? Basically, I believe that each and every individual that comes to these doors has a certain individuality to them. So I may be treating someone's back, but there might be other things that I need to treat depending on who this patient is. So it's not a cookie cutter treatment. Basically, I'll be working on, if I'm working on you, it will be individualized based on what's showing in regards to assessment. The style of massage I use is deep muscle work. I work into the tissues fairly deep. I do a lot of connective tissue work, and I find it very, very effective and very, very useful. I use a brand called Gecko. It's my favorite lotion to use. I prefer lotion over oil because oil basically bastes people. It makes them feel like they're being cooked or getting ready to be fried. It's a hypoallergenic lotion, and I love using it. I'd say neck, back, and shoulders. Well, let me tell you, my favorite treatments to do are actually working in the jaw. I love working with gloves, and I basically go into people's mouths, and it does a lot of wonderful things once the muscles in the jaw release. You know, it decreases headaches, maybe plugging in the ears, face pain, and of course like jaw tightness. The other stuff I love working with also is scars. I love working with scars. I've seen some wonderful things happen when a scar is released in regards to people's symptoms. In my opinion, I think the most difficult treatment, or the most difficult condition to treat, is plantar fasciitis. Actually, in general, like working with the feet. And the reason being is that it's not like the elbow or the hand where you can rest it and basically protect it. With the feet, you're constantly standing, you're constantly walking. So it might take a little longer for the feet to heal. Funny treatment. I have a ton of stories in regards to funny treatments or funny things happening in the massage room. But the one I'm going to tell you about is somebody who came in, I'd say about maybe 15 years ago, sometime when I started, a long time ago. He came in because he had a car accident and he was having neck pain and headaches, and this headache would not let up. So I would be treating his neck, shoulders, and basically, you know, he'd leave the treatment room, come back the next week, and say, my headaches are still there. So this kept happening constantly for the next 4 to 6 weeks, so I started getting concerned. So basically I asked him, are you constipated? Right? And the reason why I asked him this is because I had the suspicion that he was constipated and that that could be causing some of his headaches, because that can happen. And he kind of said, yes, I haven't been able to go to the bathroom for about 4 days, 5 days. It was quite a while. So what I did was I flipped the switch, shall we say, and I did an abdominal treatment. I did a constipation treatment. By the way, like, massage is very good for constipation. So I worked on his abdomen. We finished the treatment. He leaves, comes back the next week. I asked him, so how are your headaches? He goes, they're gone. I go, okay, so what happened after the treatment? He goes, well, let me tell you, I was on the bus holding onto the rail and holding on for dear life, and I wanted to get off the bus as quickly as possible. We had a good laugh. You know what? I'd go old school. I'd go back to my old afro, because I used to have a huge fro, maybe when I was in grade 8. And I would add, just to be special and different, a cowlick.